to determine the cause of death of a crocodile or any other animal. Veterinarians and biologists use a process called necropsy. This process, particularly for reptiles like crocodiles, requires precision and expertise due to their unique anatomical structure. The steps and methods for determining the cause of death are as follows. External examination. Visual inspection. The crocodile's body is first examined for wounds, injuries, fractures, skin diseases, or discoloration. For example, deep wounds might indicate an attack by another animal. Environmental signs, the location where the carcass was found, for example. Polluted water or dry land and environmental conditions, for example. Temperature are assessed. For instance, extremely low temperatures can cause a crocodile's death. Animal history if the crocodile was in a zoo or controlled environment. Information about its diet, behavior, or previous illnesses is reviewed. Internal examination, necropsy. Opening the body, the veterinarian cuts through the crocodile's thick skin using surgical tools. Due to the tough, scaly skin, strong blades or even power tools may be required. Organ examination. Heart and lungs, the crocodile's forechambered. Heart and lungs are checked for issues like heart failure or respiratory infections, digestive system. The stomach and intestines are inspected for foreign objects, for example, plastic or stones, blockages, or infections. Crocodiles sometimes ingest items that can lead to their death. Liver and kidneys, these organs are examined for signs of poisoning, metabolic diseases, or infections. Brain and nervous system if a neurological condition is suspected. The brain and spinal cord are also inspected. Sample collection. Samples of tissues, blood, or bodily fluids are collected for further testing, supplementary tests. Histopathology tissue samples are examined under a microscope to identify signs of diseases like cancer, infections, or inflammation. Toxicology if poisoning is suspected, for example, from chemicals in the water. Blood or liver samples are tested for toxins. Microbiological tests. Cultures are performed to detect bacterial, fungal, or viral infections. Fungal infections, for example, are common in crocodiles in humid environments. Parasitology. The intestines and other organs are checked for parasites, such as worms. Genetic testing in rare cases. DNA tests are conducted to investigate genetic diseases or confirm species identification. Data analysis and conclusion. Synthesis of findings. The veterinarian combines all findings, external, internal, and laboratory results. For example, if the stomach is filled with plastic and the intestines are blocked, the cause of death could be intestinal obstruction. Common causes of death in crocodiles. Infections, bacterial or fungal, especially in polluted environments. Poisoning from chemicals like pesticides in water.